A 5-year-old child has Perthe disease of 6-month duration. Taking the natural history of the disease into account, he is likely to have at the age of 30 years A. Coxa plana, B. Secondary osteoarthritis, C. Shortening of the lower limb, D. Trendelenburg gait, E. Fairly functioning spherical head of femur. And the answer is E. Fairly functioning spherical head of femur. Now let's get to know the reason for this answer. Study by Perthe et al. 2010 for the natural history of Perthe disease. The 5-year radiographic results were strongly dependent on 4 risk factors. 1. Age 6 years or more at diagnosis. 2. Total femoral head necrosis. 3. Height of the lateral pillar of the epiphysis less than 50% of normal height. And 4. Femoral head cover less than 80%. As the number of risk factors increase from 0 to 4, the proportion of patients with good radiographic 5-year outcome decreased from 79% to 0%, and the proportion with poor outcome increased from 3% to 91%. Interpretation of study by Perthe shows that most children under 6 years of age do not need any special treatment. In older children, no special treatment is indicated if the whole femoral head is not necrotic and the femoral head cover is more than 80%. In the most severe forms of the disease, there is more than 2 risk factors. Surgical containment treatment seems advisable. Study by Stulberg et al. 1981. He concluded that the clinical and radiographic cause of an involved hip subsequent to childhood was related to the type of congruency that existed between the femoral head and acetabulum. 3 types congruency were recognized. Number 1, the spherical congruency in class 1 and 2 hips. The hip in this category, arthritis does not develop. Number 2, aspherical congruency, class 3 and 4 hips. Mild to moderate arthritis develops in late adulthood in this hip. Number 3, aspherical incongruency in class 5 hips, whereby severe arthritis develops before the age of 50 years old. Okay then, thank you.